Gastrointestinal side effects from chemotherapy include nausea and vomiting, diarrhea, constipation, mouth sores, and taste changes. These side effects are expected, but we also know how to manage them quite well. Be certain to report the side effects to your cancer doctor as well as your treatment team. Not all treatments cause nausea or vomiting. Depending on what you are receiving, your doctor may have you take anti-nausea medication at home, or we may give it to you in the clinic before starting treatment. Either way, the goal is to prevent nausea. It is much easier to prevent nausea than to manage it after you are experiencing the symptom. Tips to help you manage nausea include taking anti-nausea medication as prescribed by your doctor. Avoid strong smells that can trigger nausea. When eating, choose small, frequent meals instead of a large meal. Try a blander diet, such as the BRAT diet, when you feel nauseated. The BRAT diet stands for bananas, rice, applesauce, and toast. Report to your doctor if you do not get relief from these recommendations. If you experience diarrhea, it is important to stay hydrated with 8 to 10 glasses of non-caffeinated fluids a day. Avoid high fat and spicy foods, as this can increase your risk of diarrhea. You can take over-the-counter loperamide as needed to manage the side effect. Notify your doctor if the diarrhea does not resolve. If you experience constipation, you can take over-the-counter stool softeners and/or laxatives. Examples include Docosat sodium or Senna S. Also, keep your body hydrated with 8 to 10 glasses of fluids a day. Other tips to help manage constipation include staying active. Activity is important for your gut health, and exercise can reduce the risk of constipation. Drink warm or hot fluids to help with moving your bowels. Lastly, if you can tolerate it, high-fiber foods can aid in constipation, such as prunes, bran, fruits, and vegetables. Contact your doctor if you have not had a bowel movement in over 3 days. Mouth sores occur because the chemotherapy not only destroys cancer cells, but also rapidly dividing healthy cells, such as those that line your mouth and esophagus. Should you develop mouth sores or have difficulty swallowing, call your cancer doctor and notify your treatment team. Mouth sores can be prevented by following good oral care. Rinse your mouth out with an alcohol-free mouth rinse or a baking soda saltwater rinse. You can make your own solution at home with 1 teaspoon of baking soda, 1 teaspoon of salt diluted in a glass of warm water. Cleaning your mouth 3 to 4 times a day with this solution can help prevent and manage mouth sores. Also, brush your teeth with a soft toothbrush 3 times a day to help prevent cavities. If the mouth sores are severe and affecting your ability to eat or swallow, notify your doctor. They may order a prescription mouth rinse such as Ron's Rum or Miracle Mouthwash. These are compounded rinses that can help with the pain and help manage healing. Throughout treatment, you may experience taste and appetite change and a heightened sensitivity to odors. It is common to lose your appetite for the first few days or a week following chemotherapy. This will usually resolve as you begin to feel better. Management for taste and appetite changes include eating foods that are warm rather than hot. Avoid unappealing smells and stay hydrated with 8 to 10 glasses of fluids a day. Also, refer to our team of certified dietitians for tips on taste changes.